Hi, my name is Katrin Moeseler, and today I'm going to hold my third speech, which is the informative speech, and my topic is going to be about health psychology. Did you know that health problems are closely related to chronic disease, and they are closely related to our healthy behaviors and lifestyles? The health psychology is an emerging field which links health and the positive well-being with each other, an important role that is we all deal with in our daily lives. I myself am a psychology major with the concentration of clinical psychology, and I'm currently doing research on health psychology because I would like to apply for graduate school in health psychology in the fall. Today I'm going to point out some of the main topics of health psychology. First, I'm going to give you a definition of health psychology, then I continue with the training, and I continue with settings, and also talk about the problems that health psychology deal with. Now I'd like to give you some more details about what actually health psychology is. And as I said, I'm going to start out with the definition. Two areas that health psychology has are the behavioral medicine and also the health psychology. It's been a long time. It actually dates back until the Greek civilization, when the mind and body get first discovered and closely linked to each other. And another definition, or the health psychology area, became more popular than in the 70s. Behavioral medicine is actually the integration of behavioral science and also with the practice of medicine. Health psychology, on the other hand, is a specialty area in psychology, and it's a primary science but also the profession in behavioral medicine. A recent definition that Brannon and Feist actually came up with in 2004, both of them are professors in the McNeese State University, and they're the authors of health psychology. So this recent definition that they came up with for health psychology, it includes the psychologist's contribution to the enhancement of health, the prevention of disease, the identification of health risk factors, and also the improvement of the healthcare system with shaping the public opinion with regard to health. Now that you know a little bit more about what health psychology is, I would like to go over the training requirements so you get an idea of what is actually required in order to go to become a health psychologist. You could either have a Bachelor of Science or a Bachelor of Arts. Both of them are more for working in a related field, but a graduate degree, either a doctorate degree or a master's degree, are strongly preferred in order to work as a health psychologist. For a PhD, you would have to study 5 to 7 years, and which leads to your own dissertation and your research, which is necessary in order to become a health psychologist. Now that you know what's required, I would like to tell you more about where health psychologists actually work. They, for example, can work in hospitals. What they do there is they deal with behavioral assessment and also, for example, help with patients to reduce their smoking habits. They could also work in a private practice. What they do in these areas, they more closely focus on linking the body and mind together, preventing disease, but also give social support and also help with the psychologists, their adjustment. Another area where health psychologists are employed are universities. What they do at the university, they most likely focus on research, also do teach and counsel. The last areas where health psychologists work is the prevention setting. What they do, they focus on preventing chronic disease, but also assist the patients with their changes in diet or exercise. The last point I'm going to talk about are the factors that actually cause those health problems, and how psychologists have to treat those problems. There are 3 factors. The first factor is stress. Severe prolonged stress can definitely affect the hormonal system or also the immune system. And this can in the end lead to negative effect on all the body organs. The second factor are behavioral problems. For example, smoking or excessive drinking, or also a poor diet. And yeah, as a health psychologist, you would try to prevent these. The third factor is personalities factors. These can occur when or may result from a person that is having a disease or is in the process of having the disease for a long time, and yeah, these will ultimately lead to an unhealthy behavior as well. Now I'd like to just sum up my points again that I talked about in order to conclude my speech. Today I informed you about what the health psychology is, and in order to do that I highlighted some of the points. The main points that I talked about was the definition of health psychology, followed by the training requirements in order to become a health psychologist, followed by the settings that a health psychologist works in, and also at the end I conclude my speech with the type of problems that health psychologists have to deal with. Now I hope that you have a better understanding of what health psychology is, what health psychologists work in, and also why it is such an important and emerging field in our today's society and in psychology in general.